Hello my viewers, welcome back to this channel where your health is our priority. Gout is our topic today, and let us ask ourselves, what is this animal we call gout? And basically the general explanation of this: gout is a type of inflammation arthritis that typically affect one's joint, often the big toe, although it can also involve other joints. It is caused by a buildup of uric acid crystals in the affected joint, leading to sudden and severe pain, inflammation, and swelling. Remember, gout can be quite painful and also significantly impact on person's quality of life if not managed properly. And some of the causative agents of gout: we have diet, consuming food that are high in purines increase uric acid level in the body. Purine rich food are the likes of the red meat when taken roasted, or the barbecued red meat, organ meats, especially when they are undercooked, the likes of liver, kidney, etc. And remember, I've said undercooked, they have high uric levels, but the major causative of uric acid, if you don't have other underlying conditions, basically it is more associated with the eating of red meat and alcohol consumption. Medications or the drugs such as the category we call the diuretics, the like of hydrochlorothiazides or the hctz, these are the pressure drugs. To elaborate more on the gout, uric acid, remember, is a waste product that is normally filtered by the kidney, excreted in urine. And remember, however, in some individuals, the body either produces too much uric acid or has difficulty eliminating it in efficiently, so leading to the uric buildup, which is now can be deposited in most of the joints. Crystal formation: when uric acid accumulates in the body, it can also form crystals. Uric acid crystals form and accumulate in the joints, and these crystals trigger an immune response, and the body now reacts, causing inflammation and very intense pain. How will you know that you may be having a gout attack? Often some have sudden characterized severe pain, and the redness on the area, the toes, knee, also swelling and warmth in the affected joint. The pain is typically most intense within the first 24 hours, and it can last for several days, even to a week or months if goes untreated, and it is commonly affect joints that we have mentioned: the big toe, ankle, knee, wrist, and the others. What are now the risk factors? Several factors increase the risk of developing gout, including genetics, diet high in purines found in a certain food like red meat, organ meat, seafood, and alcohol. We have just mentioned that. Obesity, the high BP, and use of some of the blood pressure regulating drugs like of the hctz or hydrochlorothiazide and the rest. They are in the category of the diuretics drugs. Kidney disease and certain medications we have mentioned, and we have said that. The diagnosis, this can only be diagnosed by a doctor based on symptoms, medical history, and physical examination. Blood test to measure uric acid levels can be asked, and treatment, how to manage gout. It's through combination of lifestyle changes and medications. Some prescribers or the doctor may decide to use the non-steroidal anti-inflammatory drugs, the likes of NSAIDs. We have the colchicine, the corticosteroids during acute attack. We have long-term management, which is the drugs like aripiprazole and febuxostat are some of the long term management drugs. You also need to check on lifestyle changes, dietary modifications by reducing intake of high purine foods and alcohols. This help to maintain a healthy weight, a healthy joint-free pain, or what we call the gout. Staying hydrated is a very beneficial factor. Joint care, resting the affected joint during an acute attack, and using ice elevation also help alleviate pain and swelling. Complications: if left untreated or poorly managed, gout can lead to joint damage, joint deformities, and the development of toffee hard nodules of uric acid crystals that can form under the skin. So be wary and warned about the gout and some of the things that we have tackled here above. My wish is just you stay healthy, avoid the things that we have mentioned above, and for a certain, gout won't be a headache to you anymore. On our comment section, I would like to hear your contribution, or the things that we need to improve or share with you. So stay tuned, and thank you for watching this video. If you have liked it, give it a thumb up, consider subscribing to our YouTube channel.